Hello again, Dr. Al Costanza, functional medicine clinician and educator. Today's topic is inflammation, or sometimes we refer to it as inflammaging, which speaks for itself. So, recently I was on a webinar with this pediatrician who wrote a book, Healthy Kids, Happy Moms. And it's a phenomenal book for those that want to learn more about integrative medicine in layman's terms. Many of the texts that are written, you need like advanced degrees like myself to understand. In the 34 years I've been doing this, to understand, and sometimes I always don't understand 100% all of it, but usually get about 90%. Well, in any event, what she talks about when she started her practice, and she was strictly doing, conventional medicine and writing the typical scripts for kids' ailments and their autoimmune diseases and their runny noses and their ear infections and their eczema and so forth, allergies, the type of things that kids have to deal with on a regular basis. And, she got some success, but not as much as that she was hoping for. And then she went through Dr. Andrew Weil's integrative medicine program at the University of Arizona, I believe it was, and it completely changed her practice. And one thing that she said, I'll never forget, she said, it took me 15 years to figure out that inflammation is basically associated with all chronic illness. And she is absolutely right on that. So that's something that, that's a physical stressor to the body. And one of the tests we do, it's called BIA. It's wholly non-invasive. It's bioelectrical impedance analysis. And what it does is it measures body composition, the body at the cellular level. So you have that biphospholipid layer, that cell membrane. And the cell membrane breaks down due to inflammation. The water shifts from inside to the outside. Water inside, good water, because you're feeding the 500 to 3,000 little furnaces called mitochondria. And the water on the outside is associated with muscle waste and fatigue, necrosis of cells, mutation of cells, edema, hypertension, if it's bad enough, because it's going to compress blood vessels. Okay, so in any event, that's a big help because it kind of gives you an indicator of how inflamed a person is. But once again, inflammation, as we age, we become more inflamed, but it doesn't mean we're doomed. So there are things we can clearly do that will reduce inflammation, and we use high dosage EPA, recommend high dosage EPA, DHA fish oil in a liquid. There's a derivative that called SPMs, and SPM stands for Specialized Resolving Mediators. And then there's an herbal formula that I've created. It's called Alive Again Beyond Relief. And basically it has in it the turmeric, the boswellia, the green tea, and several other herbs that are antivirals. So all of that taken together helps to put the fire out. And it works quite effectively, particularly the liquid that's dosed high. You generally have to dose it around 4,000 to 5,000 milligrams to get a real effect on that. And this stuff's flavored. It doesn't taste fishy, which is great. You keep it in your refrigerator. And there's a couple of good companies that make it. We could talk about that. But in any event, once again, inflammation associated with all chronic illness. You want to put the fire out, particularly for those people that have joint issues. It can help a lot with that. So for myself, I have a hip issue about 8 years ago. Inadvertently, I did a James Brown split in the rain. And I went to BI and they gave me a list of 4 surgeons, pick one. And I didn't pursue that route. I managed it on my own. So I do a combination of the anti-inflammatories, and also I take a proteolytic enzyme and I do that on an empty stomach. And what it does, it goes into the joint and it helps to dissolve the fibrin mesh. Think of the fibrin mesh as like scar tissue. So in other words, where you did damage to the joint, in and around the joint, and it forms some scar tissue, well, when you move, it's going to keep the inflammation going. So you want to be able to, dissolve that fibrin mesh, and these supplements can work quite well with that. So the combination of both, I know for me personally, has kept me from going under the knife. And then I've done some exercise, physical therapy that has helped. And most lately I bought a couple of Nordic walking poles. So I start walking more erect, and I start walking more, and because you got to keep moving, right? And that's one thing. If someone goes to a rheumatologist and says, what's the number one thing I can do that's not going to cost me any money to reduce inflammation? And that person would likely say exercise, and that would be right. So that's about it for today on inflammation and inflammaging. So stay well, and don't get inflamed. Take care. Bye-bye.